Hi, you are in the ladies' room with Dr. Donica, the only public ladies' room you can enter anytime without ever waiting online. I'm your host, Dr. Donica Moore. We'll be having real conversations with real women about really intimate issues. They may be embarrassing, sad, or funny, but they will always be interesting and informative. You know, like the best conversations you've had in ladies' rooms with your best friends, or total strangers and a physician. Please join us. Hello, and welcome to another exciting episode of In the Ladies' Room with Dr. Donica. Today, I have a very special guest for us to talk with, and that's Dr. Padmini, or Minnie Murthy, Professor and Global Health Director at New York Medical College School of Health Sciences and Practice. Dr. Murthy is an obstetrician gynecologist and an activist. And saying activist is kind of an understatement in her case. She has more energy than any 17 activists I have ever met. She's practiced medicine and public health for the past 30 years in several countries, worked in varied arenas of the healthcare industry, and worked as a consultant for the UN FPA. She holds a master's in public health and a master's in science in management from New York University. She currently serves as the Medical Women's International Association NGO representative to the United Nations, as well as the global health lead of the American Medical Women's Association, which is the only national organization of women physicians in the United States. Dr. Murthy is widely published, including 3 books. The first was Women's Global Health and Human Rights, which is used as a textbook worldwide. She also serves as a peer reviewer for several publications. Her second book is perhaps my favorite. It's called Minnie's Musings. It's a book of poetry published in 2012. And her third book, this is breaking news, Technology and Global Public Health, is hot off the presses just this week. She's delivered more than 150 presentations on women's and children's health at conferences around the world. And I hope I remember to ask her how many frequent flyer miles she's earned. Dr. Murthy's research interests include women's health and human rights, social determinants of health and diplomacy, and promotion of global health. I'm hoping to touch on all of them today. Specifically, she's been working to promote safe motherhood and other women's health initiatives in India, Malawi, and Grenada. She's partnered with other NGOs during the COVID-19 crisis to supply personal protective equipment to healthcare providers and the general population, along with other humanitarian aid supplies internationally and in the United States, especially to the Navajo Nation, which has been particularly hard hit by this pandemic. Now, Dr. Murthy is the recipient of numerous awards for her work. I don't have time to list them all, so I'll just give you some of the highlights. She was the first American woman physician to receive the Girard Oration Award in Seoul, Korea for her service and work with the Medical Women's International Association. She's a recipient of the Sojourner Truth Pin given to women who excel in community service. And she received the Millennium Milestone Maker Award at the 9th Annual Women's Symposium in China. In 2016, Dr. Murthy became the first Indian-born American in over 70 years to receive the Elizabeth Blackwell Medal, the highest honor from the American Medical Women's Association, for her work to promote women's health globally. Additional awards include those from several organizations in India, Australia, China, Kenya, and Nigeria. Most recently, she has received the iconic Women Creating a Better World for All Award from the Women's Economic Forum. Dr. Murthy is currently chair-elect of the International Health Section of the American Public Health Association, which is one of the largest associations of public health professionals in the world. She's been elected as Secretary General of the Medical Women's International Association, which celebrated its 100-year anniversary in July 2019. And she's been elected as first vice chair of the Global NGO Committee affiliated to the Department of Global Communications of the United Nations in August 2019. Most importantly, she's the mother of a daughter who is currently a PhD student in international development. Welcome to the ladies' room, Dr. Murthy.
Thank you so much, Dr. Donica. I mean, it's always great to meet you. Known you for a long time, and I've been a big admirer of yours for all the work
likewise.
You do. And especially because you put women at the center of everything you do. I think that's a bond which connects us as women physicians and activists. You're yourself an activist because you've broken so many barriers. But it's an honor to be on your podcast, and I have followed some of your work even when you were a contributor on NBC, and you were really amazing. It's not, I'm being biased in saying that, but I think a lot of the current medical contributors and reporters could take a page off from your book.
Oh,
Thank you so much.
Thank
and
you so much.
I wanted to add two things, is that one, I am chair of the International Health section as of yesterday.
Oh, wow, we do have breaking news.
Yes. And also the Global NGO Executive Committee, we do work closely with the DGC. So that's the Department of Global Communications. And so we are not exactly affiliated, it's a term, but I just wanted to clarify that we work closely with them. So fire away, I'm all yours. And thank you again for having me.
So my pleasure. You know, in that introduction and in your additional comments, we threw out a lot of acronyms for people, you know, a lot of alphabet soup. And we have a very diverse audience. I think one thing that people are often confused about is, what is an NGO? You know, explain that to people.
Great, thank you so much. And I think you read my mind, Donica. One of the things is NGO is non-governmental organization, just as the American Medical Women's Association is, and a lot of other organizations worldwide which have a not-for-profit status, and they do a lot of work. They're involved in policy, planning, service delivery at a local level, and also statewide and a global level. And because don't come under the confines of the government, they are called non-government organizations. These also do include foundations and trusts, because they're not governed by the government. So, and they work closely with the government, with the UN agencies, and also with other governments. For example, Red Cross. We all know what an amazing work the International Red Cross Society does. And for your audience, thank you so much for joining us. If you ever go to Switzerland, Geneva, make sure you visit the IRC Museum, because it's amazing. It just shows how well humanity has worked to promote humanity, you know, especially in this day and age. Again, full disclosure, they're not paying me to talk about them. But I just wanted to give them a shout out, because I think we all admire the work they're doing for such a long time. So these are non-governmental organizations.
And since you mentioned the Red Cross, I actually just tweeted today a public service announcement. And I'm not being paid by the Red Cross either, but of course I am a huge fan, as are most physicians, or every physician that I know. And I tweeted out that the Red Cross is in desperate need for blood donors. We've heard a lot about people donating plasma if they've had COVID-19, and we call that convalescent plasma. You want to explain to people what that is and why that's so important?
Thank you. I think that's important because we, as you know, globally, we have the COVID pandemic. Mm-hmm. And to put it in very non-medical terms as much as I can, and again, if I haven't, kind of put the volume down when explaining it, I'm sure you would with your expertise. It is because we are still at such an early stages. By we, I mean the global community, all the researchers and the scientists. So this plasma may help us unravel mysteries, which will help to hasten the cure. Because except for remdesivir, which has just got approval from FDA, we really don't have, and that remdesivir we don't know, because this is a disease in its infancy. And I hope it doesn't become an adolescent or an adult. It's still in its terrible twos. That's what I term COVID as, a disease in its terrible twos. You know, those of us who look back on when our children, whom we love, were toddlers in their terrible twos. So this is why the Red Cross has put this out, and thank you so much for tweeting that, and I'm going to retweet it once the podcast is over. I haven't checked my Twitter for a few hours, which is unusual because I've just been catching up with work. So that is why people want this plasma from those who have recovered, as I said, to see how can they take antibodies or other components from the blood to help others.
Right. And so the American Red Cross needs donations from people who've recovered from COVID-19, but also from everybody else who's healthy. I know, during times like this, people are afraid to go give blood because they're afraid that they might somehow catch COVID. So explain to people how the Red Cross does an exceptional job, and all the blood donation centers do an exceptional job keeping everything strictly hygienic and strictly safe for the donors, and how there's no risk to the donors.
Yeah, thank you. So they do maintain all the precautions. Everybody is masked, gloved, and when doing a procedure, most places you also have your plastic shield, and even the donors don't have to remove their masks because it's not a dental procedure. They're just taking the blood from your forearm, either your left or right arm, depending on. So that's why everything is followed, because remember, they are aware of the dangers of not following the protocol, because it's going to boomerang for them. So if you can go ahead and donate it, please do, because in this time of global crisis, we all need to help each other, and this is a way we can. It's just not donating money. It can be in anything you do. So that, I think this is really important that you brought this up.
Great, thank you. And of course, this is top of mind for all of us, because that's what a pandemic means, is it affects all of us in every country around the world. How have you and your family been doing personally throughout this crisis?
Well, thank you. Thank you. My family is doing well. My daughter's doing well. My sister, my nephews. Now, this is so, that you bring this up. I was in India, and I just got back, and within 48 hours, I was on a plane going to Saudi Arabia, and I came back on March 3rd, Danica, and then the lockdown started. So I think one of the things I have realized during my numerous trips to the Far East, wearing a mask. So even before this started, I always carried a mask with me, because when I was in the UK almost 4 years ago, I got severe allergic pneumonitis from the sycamore pollen.
I remember that.
After that, you remember? So after that, that's why I always carry a mask with me. And I think this is a very nice habit of wearing a mask. And I'm just going to re-quote what I said. I was on a UN panel on which Dr. Fauci was. And one of the things I said is that wearing a mask is a sign of respect, not only for the others, but for you also, because you're respecting your body, your health, by not getting the infection from somebody. So thank you. I think we're all hanging in there, maybe a little fed up, can't go to the hairdresser as often as we want to. Well, not going to the gym, but working out, doing yoga. And teaching medical students and other students online has been challenging. But again, one thing I think, if we just pause, we all appreciate what we have, that at least we have food on the table, you have a roof on your head, considering so many of our fellow Americans, unfortunately, are going through so much, and then even globally. So whatever we can, even if it's like having a podcast like this, you're a great connector, Danica, because in this time and age, you're using social media so effectively. That's why we all tweet. We post on Facebook or Instagram. Again, they're not paying Danica or I speak for both of us to talk.
Although if anyone wants to pay us, that's fine. And they can contact me at askdrdanica@gmail.com.
So I was trying to say that it's important we keep in touch, because for our own sanity, our own mental health, because the World Health Organization describes health as a complete state of physical, social, and mental well-being. And as a women's health expert, women are really at the brunt of this pandemic. Mm-hmm. And a recently released report by the UN Women said that every 3 months, the lockdown continues or the pandemic rages, we are going to have several 100,000 women who are being abused. Mm-hmm. And, I hope we can talk about the different ways abuses. It's just not being beaten or being, coerced into having a physical relationship without one's permission. But there's something also called period shaming, which I hope we will talk about, because I think it's really important. And I would like to share with the audience. I know Halloween is around the corner. This is not a horror story, folks, but this really happened. And, you're the mother of a beautiful daughter. I'm the mother of a daughter. And, we all do care, because a period is a part of growing up. And this young girl was shamed. So if you want me to talk about this, I would
absolutely.
really
tell us the details.
So Okay, so as you know, this is a very momentous year. 2020 is the 75th anniversary of the United Nations, right?
Mm-hmm.
And when it was first chartered in San Francisco, for the people who don't know. And this is also the 25th year of the Beijing Platform for Action, where you have the 12 critical areas of concern which focus on women. And again, this is, we have our elections around the corner. This is not for any, but our former First Lady, Hillary Clinton, made her famous statement where women's rights are human rights in that particular conference. Last year, 2019, was the 25th anniversary of the International Conference on Population Development. This was held in Nairobi, Kenya. So a lot of us went there exactly a year ago, last November, coming up. But the sad part was, Donica and other friends who are listening, a few weeks before, this young 13-year-old, I can never forget it, she committed suicide because she got her period in school. She was shamed by her teacher because she did not have a sanitary product to use. She had stained her dress. She was singled out, shamed by her teacher. Her classmates laughed at her.
And that was in Nairobi?
Yes. This was in October. This child came back home. Her mother went to get water. When she came back, she found the child hanging. She had hung herself. So this is period shaming. I mean, this is not a Halloween story. It's not about witches and ghosts. Those witches exist in us, in the human beings.
We have discussed that in a previous podcast we did with the CEO of an NGO called
International.
Water Aid. And we talked about how just simple lack of bathrooms in homes can account for thousands and thousands of girls not going to school when they have their periods. They don't have bathroom facilities or private bathroom facilities in schools. They don't have sanitary products. They don't have clean water. And we take this for granted in the United States. And I think sometimes we say, oh, that's in other countries. But there are many, many places in the United States where we don't have clean water. Of course, Flint, Michigan was a classic example, but you've done a lot of work with the Navajo Nation. So tell us about the situation with water and hygiene and health and coronavirus in the Navajo Nation.
Thank you. So I would like to give a big shout out to, our dear friend and colleague, Dr. Eliza Chen, who is the executive director of AMWA. And I refer to her as my partner in crime because
AMWA, of course, is the American Medical Women's
Association. Thank you. And so we worked closely. The American Medical Women's Association has worked closely with Operation Pegasus, which consists of medical students and public health students in Phoenix, Arizona. And I was able to reach out through one of my NGO colleagues whom I've been working with, the Suchi Buddhist Foundation. And they donated, and through the private sector, they were able to give us 80,000 PPE, which were just dropped off just like less than 3 weeks ago to the Navajo Nation. And it's just not us. This is the teamwork, because it was American Medical Women's Association, it was the Suchi, it was the private sector, the students, and the pilots who gave their time free, and the airlines where this could be dropped off. So you talked about shortage of water, and thank you so much. We have that in our own country here. Do you know that women in prisons often do not have access to sanitary pads or soap and shampoo? So one of the things I would really
I just want to say, I do know that, and I want to share why I know that. I know that because it was covered on an episode of my new favorite medical TV show, New Amsterdam. But until I saw that on New Amsterdam, I did not know that. So these TV dramas really do have a role in educating physicians as well.
So maybe they should reach out to you and I to be on their guest and talk about that. So, and let me explain. So one of the things I would really like to make a pitch for is to everybody, when you go, at least pre-COVID and hopefully post-COVID when we get there, go to a hotel, please collect all the soaps and the shampoos and the toothpaste. I do that. They think I'm a soap hog. And then I explain to them, because I bring them back, I give them off in soup kitchens, in churches, in shelters. Do you know how grateful people are? Because my mother, who passed away, and by the way, I loved your mother's tweet. I put a big heart on that. Thank you, Donika's mommy, for that lovely tweet. We all love Donika, and I hope you've tuned in. If not, I'm sure she'll listen.
She's my most loyal listener.
So I just wanted to say that please collect these and drop them off, because it makes a difference. Mm-hmm. So it's not only in those countries, as you said, Donika, it's also here. And more than ever, we need to, because you know what? Periods don't stop because there's a pandemic, right? Mm-hmm. People don't stop getting pregnant because there's a pandemic.
Yeah.
So, but we still need to do what we can do. So the American Medical Women's Association is so proud to have partnered with Operation Pegasus and the Suchi Buddhist Foundation, and also with the Robonauts, because these young people, they designed these 3D, remember they printed out the face shield. So again, this is what we've been doing. And you know, even though I speak for all of us physicians, especially in American Medical Women's Association, we've been around for almost 104 years, but we always had service at the very, very crux of the organization. Like what Dr. Donika is doing through this podcast, it's just to get the message across. Because in this day and age, this is what we are doing. We're using social media to make ourselves come closer. That's why I called you a connector.
Mm-hmm. Thank you. You know, I think what's interesting about this pandemic is we usually rely on our federal and state governments to respond to these kind of crises. And then our huge national organizations like the American Red Cross or the Salvation Army or, you know, other emergency FEMA. But in this pandemic, we have had a slow and very inadequate national response. On a state level, some states have done a Herculean job and other states still haven't gotten the memo that there's a pandemic out there. We have an increase of COVID this week in 47 out of 50 states. And many states have their hospitals and ICUs are full and overflowing to capacity. But it's on the one hand, it's a tragedy that we had a national shortage of PPE for first responders and healthcare workers. But on the other hand, I was very gratified to see my neighbors and, you know, people, you know, from all walks of life making masks and donating them to their hospitals and donating them to senior centers and giving them out to their neighbors. And this ties in also to the issue of donating blood, because this is just something everybody can figure out what they can do. And when we're talking about a pandemic, it's all hands on deck. And if you can take any step to reduce this infection from being transmitted to one person, then you've accomplished something. And I want to ask you, just so everyone in the back can hear loud and clear from a international global health expert, what is the number one thing that each and every person can do to decrease the transmission of coronavirus?
Wear a mask.
Say it again to make sure everybody heard.
Wear a mask. It is a sign of respect. You're respecting yourself. It's not a violation of human rights. Please wear a mask for your own sake first, for the sake of the others, and also hand washing. And you know, Donika, we are primates. We have a tendency to touch our faces. I just want to share this with your loyal listeners. Thank you so much for having me on. So we need to wash our hands, because unconsciously, being primates, we touch our faces, and that's how infection can be transmitted. And the other thing I would say, apart from wearing a mask, is please continue to maintain the social distancing. And if you don't have to go, avoid crowded places.
Right. And this is what I say to everybody who tells me they don't want to wear a mask. I've stopped arguing with people who don't want to wear a mask.
I don't argue with them too.
And, this one person said to me, oh, I hate wearing a mask when I go shopping. And I said, well, I don't wear a mask when I go shopping. And that was not the answer she was expecting from me. And she's like, what? You don't wear a mask when you go shopping? I said, no, I go shopping from the comfort of my laptop at home. I do most of my shopping online.
Yes.
And even with my groceries, I shop online and I have them delivered. So thank you, ShopRite. Now, you talked about touching our faces. Of course, as women, we also touch our hair a lot. And I love the fact that you brought up the hair issue. So most of our listeners are listening to us as a regular podcast. They're not looking at us on video. So they can't see that you and I are both way overdue for going to the hairdresser. And you and I have talked about this before. We are women physicians and we are health leaders and we are activists and advocates, but we're also women. And we also deal with the same vanity issues and concerns about our appearance that every other women do. So I want you to share with our listeners why you have chosen not to go to the hairdresser.
Thank you. Actually, if they could see me, I would hold up my tresses because the way I chop them, I put my hair all in front of me and then went and then took the scissors and just cut. The reason I did not go to my hairdresser, whom I have been going to every week for the past 12 years except since when COVID started, is because I don't know the people who come there. I don't know where she has gone because I'm not going to ask her personal issues. So, and they are what are called asymptomatic carriers. You know that, but this is for the sake of our listeners. So even though you think that person looks healthy and they just scan with their, the thermometer to say that, oh yeah, you have a temperature, which you don't have a fever, you could still be harboring the virus. You may be asymptomatic because there is a period before you can become symptomatic. So at this point, I just want to minimize my risk because number two, I had an episode of allergic pneumonitis, as you know, so I do not want to risk
what that is.
Yeah, so when I was in London almost 4 years ago for a medical conference, suddenly I felt breathless and I was wondering what happened because I'm an active person. And then
you're not a smoker.
No,
and
never been.
You don't have any other respiratory.
No. So it was so strange and I felt like choked. And this is when I came out of the Royal College of Surgeons for a meeting. And, after 3 days, I came back home and I was coughing on the plane. I said, and it was a dry cough. There was nothing, no fluid coming out, no runny nose. Then when I went for my checkup, I go this is bizarre. And then I got a chest x-ray and then I went back for a CT scan. They go oh, you have pneumonitis caused by the sycamore. So my pulmonologist, he told me, you have to be so careful, which I know being a physician. That's why I just avoid going to the hairdresser or any places or even eating out, even though we love to eat out. The only thing is you get a takeaway, you wipe that down and then you eat it. But it's so nice. The days of going to a restaurant, I think will come later because as you can see, there are so many studies which they find people increase risk when going to a restaurant, even though you sit under those tents. You never know. You just have to be extra cautious. And I am a little extra cautious without sounding neurotic because of this allergic pneumonitis, because I have this underlying risk to any respiratory illness, and COVID is primarily a respiratory illness. So that's why I decided, I'm not running for a beauty contest now. I really don't care that my hair is not as nice as it ought to be. It looks okay. And that's what we just do. We improvise and we get onto Zoom. Even my dentist, I went after so long and I go okay, have you finished seeing me? Can you put a face shield in front, please? And then I immediately, after those few minutes, I immediately put my mask and I had my hair bundled up in a cap because, in a dentist chair, you go right back. And the minute I came, even though I had taken a shower in the morning, I took another shower. The reason I'm saying it, we have to be careful because COVID is not saying, hello, can I attack you? You know, because we may be tired of the virus, but the virus is not tired of us. This is the challenge we are facing.
Absolutely. So the reason I haven't gone to the hairdresser
Yes.
yet is because I don't feel like it's something worth risking my health or my family's health. And while I have not had COVID and I don't have any underlying risk factors, aside from being a woman of a certain age, which a study just came out. I told you about a study just came out a few weeks ago that showed that women 50 to 60, or women who are within 10 years of menopause are at increased risk for COVID. Not for dying from COVID, but for getting COVID. So
and we
I
are there.
Exceptionally careful. But also, my son did have COVID in the very beginning.
I know.
And so, when you've seen it firsthand and when you see somebody who's totally healthy all of a sudden be breathless, that's a terrifying feeling. So I don't feel like my vanity is worth my health. Although somebody did post a picture of me from that AMWA conference we did last week on menopause on Twitter, and my hair was just all over the place. And I thought, oh my God. But I want everybody to know this is my natural hair color because of course I haven't had my hair colored since January.
Yeah, but thank you so much for sharing that. And you bring up a very important point that your son, a young man in the pink of health, because this is still October, I use the term pink of health, got this. And as a physician, but more than that, as a mother, you must have freaked out. So you put it so well that it's not worth the vanity. That's what I say. It's not worth my compromising my health or my family's health. And as I said, I'm not running for a beauty contest and we're not going anywhere. And as you said, it doesn't matter. You take me for what I am, who I am, not how my hair looks, right?
Absolutely. And I think that's one of the good things about this pandemic. And there certainly are some good things. The first thing is we're all in the same situation. There are clearly people who have gone back to the hair salon. I also have chosen not to wear makeup during the pandemic. The only time I wear lipstick is when I'm doing a podcast, because I certainly don't want to wear lipstick with a mask. So that's a pleasure. We're all wearing very comfortable clothes, except you're stunningly dressed. I love your...
Thank you. But I'm wearing my sweatpants.
We're all wearing sweatpants. The question is whether we'll go back to regular clothing after this. But I want you to switch gears a little bit.
Yes, sure.
And I know, certainly having been trained in OBGYN and being very involved in global health projects with the health of mothers, I want to talk about the increased risk of maternal mortality in the United States. Again, this is something we think about as being an issue in other countries. But we've seen this in the United States. And just this week, we lost a young woman physician who was a resident, chief resident, and she died after giving birth, tragically, as a result of preeclampsia, or obviously eclampsia, or what people sometimes refer to as toxemia of pregnancy. So first, explain to us what eclampsia is and what preeclampsia is.
Thank you so much. Well, it's like I'm carrying colds to Newcastle, you being the OB/GYN asking me. It's in very simple terms. It is when women have high blood pressure during pregnancy and they get convulsions or fits, then it's eclampsia. If they just have a hypertension, that is high BP without fits, it's preeclampsia. And the other thing is they get what is called an aura, as we call it. Sometimes they know they're going to get sick and they may have a warning sign, which a lot of epileptics, as you know, may tell us, like they know when they're going to get it because they have this strange sensation. Unfortunately, we stand way down when we look at our maternal mortality rates. I mean, way down, I mean, not the lower rates, but way down in the care our people get. And again, it depends on where you live or who you are, and not even, and if you don't have access, like there's so many women, as you said, my heart goes out to this young resident who died giving birth. It's supposed to be a time of joy and celebration, but we don't know what happened as yet. It happens to so many women. And unfortunately, this has been seen more in women of color too, as we know. And, you know, we are in neighboring states. You're in New Jersey. I'm across the pond in New York. In New York too, there's been an increased disparity in the maternal mortality rates among women of color and other women. I think the way this can be done, again, you know, a lot of our colleagues, Donica, non-medical colleagues, will say that home birth is good, but my mantra always has been is there's nothing called a normal delivery till you are out of it with your baby. Do you agree with me? Because
Absolutely.
the first 24 to 48 hours are crucial.
The thing I always say to women is the goal of pregnancy is a healthy mother and a healthy baby. How we get there is not as important as getting there.
Because it's the outcome. And I always say, the other thing I say, that maternal mortality, there is no cure, but it is preventable. So we need to make sure, just as we were talking about wearing a mask, as you said, and both of us said we avoid going to the hairdresser because of the reasons, you know, we outlined. It's the same thing. So when a woman is pregnant or she thinks she's pregnant, go to your medical provider, go to the nearest health center. And if you are having something unusual, like a bizarre sensation, you may have like burning in the chest, don't think it's, oh, it's because of the spicy food I had before. It's better to be overcautious rather than neglected and, you know, coming down. And I really think we need to have a major policy change. You know, it's easier said than done in how we address this issue, because women matter, more so women who are pregnant, because it's just not their life, but it's also the life of the infant they are carrying.
Well, the other thing I say is, you know, I get so angry when men or older women say, well, why should health insurance have to cover maternity benefits? Because I don't benefit from that. And what I say is 100% of the citizens of the United States come from pregnant women. 100%. Everybody came from a pregnant woman. So, you know, I don't care how you define gender. I don't care how you define the life, when life begins. 100% of the people in this country, whether they're citizens or not, came from pregnant women. So that's what's extremely important. I think the biggest issue is not women not going for prenatal care per se, but the issue you mentioned about access. And access is, of course, in the United States, we're always talking about how access means also being able to afford it, and means it has to be covered by your health insurance, and you have to have health insurance. But one of the other huge issues in obstetrics across the country is that in rural areas, many obstetrics wards in many hospitals are closing down because they can't afford their insurance, their malpractice insurance and their liability insurance. And so many women are finding themselves in a situation where they live, you know, maybe 2 hours from a hospital, which in obstetrics is not desirable at all.
Absolutely. And this happened. There are so many more, as you mentioned, and again, you must be having telepathy with me, because this is what I tell my students, whether it's my medical students or the public health students, is when cuts are made, the people who are affected most are women, because they are cutting down the obstetric wards. And as you said, not only malpractice, or they don't have enough funding to run these, or they're kind of merged into something, and the 2 hours may even become 4 hours. And that is a question of life and death, right? When there is an emergency.
Well, in my first pregnancy, I had a high risk pregnancy. And actually my first gynecologist before I became an obstetrics patient was Dr. Sadi Keswani,
I know.
who introduced us. Another incredible leader in global women's health, and talk about a connector. She's amazing. But anyway, I had a very high risk pregnancy. I went into labor when I was 20 weeks pregnant. And then finally, and I was on bed rest and medication and the whole thing. And finally we get to the end, and my doctor just wanted to put me in the hospital for the rest of the pregnancy. And I refused. So what we agreed on is I stayed at a hotel 5 minutes from the hospitals because I lived 45 minutes from the hospital, which Dr. Keswani and my obstetrician felt was unacceptable. And I agreed. But, I made this bargain that I could stay at the hotel instead of the hospital.
But here's the thing. You had the access and the means. So what about women who don't have access and the means? So that becomes even harder, because not only are we thinking about the insurance covering, but also for the out-of-pocket expenses. Mm-hmm. So that is, thank you for sharing that. It's a major issue. Mm-hmm. Like after my daughter, my second pregnancy, I had a blighted ovum. I usually don't share this, but I have no problem sharing it now. Mm-hmm. And I started spotting. And then, of course, I had to go because it had to be terminated. But what I always think, what if I didn't have the access? And I thought it was a heavy period because it was just like 6 weeks after I was pregnant.
So explain to people what a blighted ovum is.
Okay, thank you. So a blighted ovum is when the baby stops growing properly. That's
the egg
before. I was just going to come to that.
The egg, because it was never a baby, right?
No, I was going to come to that. Okay. The reason I used the term baby was I put the, the cart before the horse here, right? So the fertilized egg or the ovum of the woman does not grow and divide as it ought to become the baby, forming the whole human baby. That means there's a problem with it. That's why it's called blighted, like you have potato blight or a blight on a plant. And then that means it's a failure in terms of or not being a viable pregnancy. And sometimes the woman usually presents with bleeding. So I started bleeding. And then when they did an ultrasound, they found that, and, I was upset, but there was no other choice. So that is why I just wanted to say that, just because we are physicians, it doesn't mean we have a easy time, like sailing through pregnancy. We all have gone through our share of pain and hardship. But again, we were fortunate enough to have the means and the access and to even get identified that there is a problem. That's all I wanted
and the knowledge to understand what our options are. Mm-hmm, one of the, first of all, I'm very sorry that this happened to you, and I'm sorry that you went through this.
Thank you.
It's a fairly common experience. And, when I explain to women what a blighted ovum is, I don't like to use the word failure, but we do use that word a lot in obstetrics. We say failure to thrive, failure to grow, failure to progress, as though there was something you could have done. This is an example. What I say to women is this is not even a miscarriage. This was just a malfunction in the processes that were responsible. There was never a heartbeat. It never got to that stage. And there was, what I always emphasize to women who have that situation is there's absolutely nothing you could have done to prevent this. It just was, I sometimes use the term a false start or a false alarm. It's a pregnancy, but it's not a baby. And it gets to that point. So I think, that's very important for women to
absolutely understand. That's why I said it was like, I used the term failure because of my, that's why I called it non-viable. That means it was not living. And you just put it more, you explained it better being the media guru. And for me, my medical terminology, kicked in. So that's why. And that's the reason, again, see, I tried to say that this was a baby, but what I meant was it was not going to be a baby. And I said, that's why I put the cart before the horse, or the chicken before the egg. But again, this is why I think as women now, this is the thing about having programs like this. As I said, we're all connecting each other. And even, Sati Keswani, whom we call Auntie Sati fondly, who's an amazing person. I mean, she's an octogenarian, God bless her, but she will give us a run for our money, right, Danica?
Absolutely. And let's just take a minute and let's pay tribute to Dr. Keswani, because she is an octogenarian. She has been a mentor to probably thousands of women physicians around the world. She was my friend before she was my doctor. She saw me through, some amazing things as a doctor. This is a story I've never shared publicly. I was actually I was at the American Medical Women's Association meeting in the in early 1993.
Okay.
And I had come from another meeting in Atlanta. And when I was in Atlanta, I was so hungry, I made the driver stop on the way to the airport to pick up a hamburger. And I wanted it rare, which is something I never, ever, ever eat under any circumstances. And I just inhaled this rare hamburger, got on the plane, went to Washington for the AMWA meeting. I got to the hotel room and I turned on CNN, which I always do when I get to a hotel room to see what happened in the world while I was traveling. And they had breaking news that there was an E. coli outbreak in Atlanta in hamburger meat. And I'm watching this, and people were dying of E. coli outbreak of raw hamburger meat. And while I'm watching this, I start getting a severe stomach ache. And I'm thinking, oh, this is funny. I'm having a psychosomatic reaction to seeing this on television. Then I started to throw up. And I thought, oh my goodness, I had this hamburger and I could have this. And I called my husband and I said, what should I do? Should I go to the hospital? And he said, is there any chance you could be pregnant? And I start screaming at him. And I said, why do men always think that you're pregnant when there's something wrong with you? And then I started hemorrhaging. So I went to an OBGYN next door to get examined. And then the doctor told me I had to go to the hospital and have a D&C because I was having a miscarriage. And I turned into a psycho crazy person. I just said I was not having this. But Dr. Keswani was at the AMWA meeting. So she came to my hotel room to examine me. And she also wanted me to go to the hospital to, have a D&C. And I just refused. And my husband came down and he tried to convince me to go. I just wouldn't. I just was a crazy person. And I just said, I'm staying in this hotel until I stop bleeding. And that child is now 27. But he loves to say, he loves to say, Mommy, tell me the story of when I tried to be a misborn.
Oh, I like that, misborn.
A misborn.
But you see, your gut feeling kicked in and your maternal instinct there. You did not think with your physician hat.
Not at all. Because everything medical said this was woman,
mother's hat. So I think that's why it's so intuitive. As women, I think we all do have a little bit of that intuition, especially when it comes to your child. And when my daughter even had a cold, I would be sitting in front of her bed, looking, checking her temperature. And then everybody would say you went to medical school, you really did so well. I said, yeah, but here I'm a mom, I'm not a physician. So I totally, and it's so nice he's there. And oh my God, what a handsome young man.
Oh,
so what I wanted, they got good genes from their mommy.
Yeah,
but what I wanted to say is that it's so important. And thank you for sharing that. And again, Dr. Keswani or Auntie Sati has been an amazing mentor, a friend. And, I lost my dear mom 2 years ago, who was a fabulous woman. She was a French professor. Oh. And Auntie Sati has tried to be another mother to me. So I am so thankful. And again, Danica, as you all said, so I just want to say, not because you're interviewing me, but I've told you that before. I'm so thankful that you are in my life, because not likewise. Only as a physician, but a woman and, somebody who's caring, and we are upfront. It's because it's what you see is what you get. And I think that's why, we are activists because you get the message across as is. We are not offending anybody, but you need to get the facts out.
Yeah, and we believe in facts, and we also believe in, sisterhood. And I think that's very important. You mentioned something interesting before about, this issue of women physicians tending to have experienced a lot of the things that their women patients experience. And there was actually a paper years ago in the New England Journal of Medicine that showed that at that time, and I think at that time, it was probably like in the early 1990s, that about 80% of women physicians had complications of pregnancy, which is way higher than the average percentage of complications in average women in the United States. So you have to ask the question, well, why would women physicians be more likely to have complications of pregnancy? And the number one issue, of course, is that
stress.
Stress.
I said stress.
Absolutely. We tend to do all the things in pregnancy that we tell our patients not to do. We're on our feet all day long. We're up all night, or every second or third night. So we're not sleeping. We're not putting our feet up and resting. We're certainly not eating properly. We're certainly not drinking enough. I remember also after I had my first child, I wasn't producing enough milk. And of course, I was committed to breastfeeding. And I was also at an AMWA meeting, and he was 7 weeks old. And so I decided, instead of making small talk with other physicians, I'll ask them what I need to do to produce more breast milk. And I was dehydrated. It was just not drinking enough water. So it was very simple solution, but it was something, I didn't really think about. But the number two issue is that women physicians tend to be older when we get pregnant. So age in and of itself has issues. So I want you to address that, because one of the pet peeves I hear from a lot of gynecologists is that women don't really understand the impact of age on their fertility and on their pregnancy.
Well, to put it simply, as we grow older, our clocks start winding down. In this case, it's your biological clock. And there is also your eggs age, and it's the same for men. As you are aware, older men in their 40s who have, fathered children, there's a slight risk of autism among those children, because there was a study a couple of years ago which said it might be due to what is they called aging of the sperms, but it's not that well. The studies are much less compared to that for women where the eggs age. And, like I always tell my daughter, if you want to have a child, go ahead and have it before you are 35, for any young woman out there. And also you need to have the patience, because our body, age takes a toll on its body. Like, we are in our 50s, we cannot run the way we used to, even though we want to, as we were in our 20s and 30s when we were training a younger physician. So we need to accept that. And also we need to do what we can, not only to help ourselves, but to make the pregnancy easier and less complicated. So the older a woman grows, I'm not saying all women again, she has likely chances are increased of having other medical complications complicating her pregnancy to make it a little more difficult, and she has to keep an eye about it.
Is to distinguish between obstetric complications, which are things that happen as a result of the pregnancy, versus medical complications, which include things like diabetes and high blood pressure. And that actually is one of the big issues in rising maternal mortality in the United States that we didn't talk about, is the number one medical complication contributing to rising maternal mortality is actually obesity. So why is obesity a problem for pregnancy?
Because what happens in obesity, as you know, it definitely does. If the woman is obese, she may be diabetic, higher chance, or pre-diabetic. And what happens is the infant, she's carrying maybe bigger than normal, as we all know, large gestational age infants. And when she delivers, they could be trauma to the baby, they could be trauma to her. So again, that's why I talked about medical complications, hoping you would, talk about the obstetric. So just to tell your audience that the medical complications like having increased blood pressure or diabetes or being obese can also lead to complications for the mother and the child, because how many times haven't you seen children born to obese mothers or those who are diabetic with respiratory distress, which is again a challenge. So, and I'm talking globally, well, these women sometimes come to have a child. And even here, unfortunately, in some of in the United States, we have this problem too, where women do not have access and are not aware. So they're two different things. It's not only having access, not having the means, whether it's insurance, or not even being aware that they think sometimes having a very high calorific diet in fats may be good, when actually, when you're pregnant, you're eating for two. But again, you need to make sure that the food you eat is pretty much healthy and don't overeat, as is the case with anything, right?
So, we talked about the obstetric issues, the access issues, the insurance issues, the rural hospitals closing, the medical, since the pandemic, everybody knows the word comorbidity. But the other issue affecting rising maternal mortality in the United States is the opioid crisis. And we have talked about the opioid crisis in a separate episode of this podcast, so I don't want to get all into that, but I just want to remind people that we didn't forget that, that's a big issue.
Yeah, just to add on one sentence to what you said, it is, and also it does affect one's mental health. That's what I wanted to add on. And coming back to the WHO definition, if a woman is not in her, is having mental health challenges, that could also be a comorbid condition influencing the outcome of the pregnancy and the birth. So I just connected what you said, the opioid, to say it can cause mood issues and mental challenges.
I could, of course, talk to you all day about just about anything, especially when it has to do with medicine, but we've got to wrap up. So before I let you go, I have to ask you, the one question I ask everybody in this podcast is, aside from this interview, what was your most unique, interesting, or memorable experience that you ever had in a ladies' room?
Okay, that's an interesting question. So I would say the most memorable and interesting experience I had in a ladies' room was I met this very interesting woman who later became a good friend of mine, because it all started with her bra strap was showing, okay? So, and we were at a meeting, an international meeting. So I went up to her and I said, "Excuse me, I just did this to myself." I was like, because it was showing pretty obviously. Yeah. And she was so thankful. And she said it was showing like that. And she said, that's why maybe people were giving me weird stares. I said, well, one of the things I learned is just to do this so people know what they have to do. So she was so, and then we exchanged numbers, because and then we became good friends after that. So I was just thinking, why was this a memorable experience to me? Is I was thinking, do I go tell her, or at the risk of being impolite or being like rude? But she appreciated it. But I took a chance because she was a woman, right? And we were both in the ladies' room trying to, powder our noses to sound very British. That is the term they use. So I think this was one of my memorable experiences. And I just wanted to add, she also contributed to this book, Technology and Global Public Health, which you were so kind enough to mention. She did contribute to this. So that's why I just linked it up to say that was a memorable experience.
That is great. And, it all comes back. It all, it's the circle of life. I'm so glad you mentioned your book again at the end. How can people get it? Technology and Global Health.
Thank you. They can go on to Springer website That's SPRINGER.com, and get it. And one of the things, as I did with my first book, the proceeds of this go to whatever I get, support women and girls. So that's why, I did that with my first book, Women's Global Health and Human Rights. The proceeds went to Mother Teresa's foundation, because I think humanity is, I would just like to end by this, if you humor me for 1 minute. Humanity exceeds religion, race, and what you believe in. This is the thread which connects us. That's all. So stay safe, everybody. And you know what? We help each other as much as we can. And thank you so much. It was really a pleasure.
It was such a pleasure. It's always a pleasure talking to you, but such a particular pleasure talking to you in this format. Thank you so much. Stay well, stay safe, and good luck.
Thank you.
That's all we have time for today. But let's keep the conversation going on Twitter or Facebook at Dr. Donica. And please join us next week for another episode of In the Ladies' Room with Dr. Donica. Real conversations with real women about really intimate topics.